Hello again, my students. Now we are going to talking about the one of the most important topics in the urology, which are the urinary tract infection. The content of our lecture should be an introduction. Then we have to have a classification of urinary tract, and etiology and risk factors, the pathophysiology, the clinical manifestations, and the diagnosis, the medical management, and conclusion. This picture shows the anatomy of renal and its location in the body, and the renal and the blood supplement, which are the renal artery and renal veins. The introduction of the urinary tract infection, we should know that there is a symptomatic presence of microorganisms within the urinary tract, such as like the kidney, ureter, and bladder and urethra, association with inflammation of urinary tract. The significant bacteriuria are present in the urinary tract infection. Asymptomatic bacteriuria is defined as a bacteriuria with no symptoms. The urethritis, which are infection of anterior urethral tract, which have the symptom of dysuria, urgency, and frequency of urination. The cystitis, which is the infection of urinary bladder, which have the symptoms of dysuria, frequency, and urgency, biuria, and hematuria. We have acute pyelonephritis, which is infection of one or both kidneys, sometimes lower tract, also biuria, fever, painful micturition. The chronic pyelonephritis is defined as particular type of pathology of kidney, may or may not be due to infection. This structure is give us the types of urinary tract infection, the upper urinary tract infection and lower urinary tract infection. The lower urinary tract infection is divided into cystitis and urethritis, and the upper urinary tract infection have divided to acute pyelonephritis and the chronic pyelonephritis, interstitial pyelonephritis, and renal abscess. The causes or etiologies and risk factors for urinary tract infection is urethra verticular reflex from urethra to bladder in the reverse direction, and the uretrovesical or vesico-urethral reflex flowing urine from the bladder and into one or both ureters, also in the reverse direction. Fecal contamination of urethral meatus, sexual intercourse, instrumentation of urinary tract, such as like the Foley catheter, the stasis of urine, which considered to be the one of the main causes of urinary tract infection, the obstruction of urinary flow and prevalence in 8 times higher in the female than males.
The pathophysiology of urinary tract infection is maybe have it or understood the 4 routes of bacterial entry to urinary tract, which is ascending infection and blood-borne separate and lymphatogenous spread and direct extension from other organs. Ascending infection is where the organism are entering the urinary tract and colonize in perineal and periurethral areas, causing urinary tract infection, which is ascend to bladder and kidneys. While the hematogenous spread is occur when the blood-borne spread to kidney, then going to occur in the bacteremia, and the bacteremia due to the blood-borne going to give us the urinary tract infection. The comparison or simple comparison between lymphatogenous spread and direct extension from other organs. The lymphatogenous spread is main through rectal and colonic lymphatic vessels to prostate and bladder, and in women through the periuterine lymphatic to urinary tract. While the direct extension from other organs, we have the pelvic inflammatory disease and genitourinary tract fistulas. Clinical manifestations of urinary tract infection. We have lower urinary tract infection, which is cystitis, frequent pain and burning on urination, which is the main manifestation, spasm in the region of bladder and suprapubic area, hematuria and back pain. Upper urinary tract infection, pyelonephritis. We have the manifestation of fever, chills, flank pain, painful urination, pain and tenderness in the area of costovertebra in the cases of CVA. Renal failure at later stage can occur. Sign and symptoms can be nausea, vomiting, pruritus, weight loss, edema, fatigue. Other signs and symptoms: urgency, frequency, burning sensation, pain on urination, nocturia, the pain and spasm in the region of bladder, pyuria, which is defined as white blood cells in urine, the hematuria, bacterial colony count increase. The hematuria also have defined as a blood in urine. The diagnostic tests of urinary tract infection are the first one is colony count, at least 100,000 colonies per millimeter of urine on clean catch urine. Clean catch is a midstream urine. Cellular finding, microscopic hematuria, white blood cells increased, urine culture, Escherichia coli, test for sexually transmitted disease. Other tests: intravenous urogram IVU, intravenous byelogram IVB والultrasound. Cystitis, lower urinary tract infection, inflammation of urinary bladder, and most often caused by ascending infection from the urethra, occur more in women. The diagnostic evaluation. The first line of diagnostic evaluation is urine analysis and urine culture. The urine examination include the following: urine color, urine clarity, and other, urine pH and specific gravity, test to detect protein, glucose, and ketone bodies in the urine, proteinuria, glucoseuria, and ketonuria, respectively. Those tests are going to be routinely tested when we have urinary tract infection until the urine culture said there is no growth of bacteria. The microscopic examination of urine sediment after centrifuging to detect RBCs, hematuria, white blood cells, casts, cylinderuria, crystals, crystaluria, pus, biuria, and the bacteria which is we called bacteriuria. This table shows that the renal concentration test, specific gravity, the purpose of specific gravity is evaluate ability of kidney to concentrate solute in urine, which is in normal values has 1.010 and 1.025. The urine osmolarity also has been detected. The 24-hour urine test, creatinine clearance test, we call it a creatinine clearance test, which have a normal values have been taken according to the age, or either the patient is male or female. It's also measured in millimeter per minute over 1.73 millimeter square. Also, we have to make a serum test, creatinine level, urine nitrogen or blood urine nitrogen, and we have blood urine nitrogen to creatinine ratio. The X-ray films or imaging films or imaging studies and other imaging modalities, we have to detect the kidney, ureter, and bladder studies. We have a general ultrasonography, we have bladder ultrasonography, we have CT scan and MRI, we have nuclear scan, we have intravenous urography, we have IVB, we have cystography, we have renal angiography, we have a biopsy, a renal and urethral brush biopsy. We have to take it when we are suspect that the patient has CA in his bladder or in renal or in urethra or ureters, or in the urinary tract at all. The urodynamic test also has been taken for the patient with urinary tract infection. This table shows us that the urine color has the signs or has the indicate or have the indicate of we make our indication of causes according to the urine color. The colorless to pale yellow of color show us that we have should be shown the cause as a dilute urine due to diuretics, that the patient taken diuretics, or he is alcohol consumptor, or he is diabetic and has a diabetic insipidus, glucosuria, excessive fluid intake, or renal disease. When we have the urine is colorless or pale yellow, while yellow to milky white, that the urine or that the patient has biuria, infection, or vaginal cream. Bright yellow, that the patient has multiple vitamin preparations. Pink to red, hemoglobin breakdown or RBCs in the urine, hematuria, gross blood, and etc. Blue to blue-green, dyes. The patients maybe have to have an X-ray with dyes. or contrast CT or CT with the contrast, methylene blue, pseudomonas species. Also the orange to amber, concentrated urine due to dehydration, fever, bile, excess bilirubin, or carotene. The brown to black urine color have to all red blood cells in the urine and urobilinogen, bilirubin, melanin, and the porphyrin. So all of those colors are going to get us the cause of change in urine. The urinary tract infection management. The symptomatic urinary tract infection, antibiotic therapy. Asymptomatic urinary tract infection, no treatment required. In the case of symptomatic, we have antibiotic. In asymptomatic, no treatment required, except in special situations. And non-specific therapy. Non-specific therapy is have two lines: more water intake and maintain acidity of urine by fluid like Camber choose. The Camber choose is correct the pH of the urine, which may not let the bacteria to rise in numbers, of course. The antimicrobial therapy. Goals of therapy is elimination of infection, relief of acute symptoms, and prevention of recurrent and long. The antibacterial agents. Common medicines include ampicillin, trimethoprim. The conclusion of our lecture that urinary tract infections are the second most common bacterial infection. The women are the most infected subjects in the population. Development of resistance to antibiotics by the bacteria result in problems during the treatment and lead to replace or recurrence. Recent advances such as development of immunological like intranasal vaccines may result in the lifetime cure of the infection in the future. So we have to know that the recurrent has the highly rate incidence in most common infections in urinary tract infection. So we have to test and retest to avoid that recurrence. When we have to take a urine analysis, detect that we have an infection in our urinary tract, then we have to make a culture to detect the most significant choice of antibiotic and get our treatment. Then have to take a treatment at the period that the doctor says. Then make another urine culture and detect the bacteria grows or not. If it grows, recurrent I'll make the treatment for the second trial. Then have a culture and then have the treatment until the growth of bacteria stops. The nursing considerations in urinary tract infection: reducing pain, antimicrobial therapy, antispasmodics, hot tube bath. All those considerations is to reducing pain, maintain adequate elimination pattern, and is encourage a lot of fluids, avoid the cause. Give knowledge, perineal hygiene, void every 2 to 3 hours day. If cause is sexual intercourse, void immediately after intercourse, and take antimicrobial. Avoid indwelling catheter. So the knowledge is most important thing in urinary tract infection. Also the women should know how to take it toilet hygiene. Most of women have to toileting or and then hygiene from the back to front, while they have to make their hygiene from front to back to avoid getting the bacteria from the anal area to the perineal area. Assess vital signs. The vital signs change in infection. We notice the increase in renal, in temperature, and increase in pulse also maybe, and increase in respiratory and blood pressure maybe when the renal are affected, or other hormones. Thank you for your listening, and we are going to see you in the next lecture.